the whole-time director and the group CEO of the company, Dr. Sanjay Sharma, now joining us. Mr. Sharma, thank you so much. Ashesha here. First up, let's talk about the new PPP mandate that you have signed for the hospital, 550-bed hospital in Prayagraj. Can you shed some more light on what this means for the company? What will the timeline look like with respect to that, and what will your investment be?
Firstly, thank you so much for the invite, and good morning to you and to your viewers. Yes, I'm pleased to announce that this mandate on public-private partnership has been awarded to us from Prayagraj Municipal Corporation, Uttar Pradesh, to develop a 550-bedded multi-super specialty hospital in Prayagraj, Uttar Pradesh, which is also known as Allahabad. It is in a very centralized, densely populated area close to a rail ghat, just 2-3 kilometers from Sangam Ghat. And we feel it's a major, you could say, impact which will have in our organization. This is one of the first private public-private partnership which we have entered. The total cost would be about 200 crores, and we'll get about 2 years to build up and develop this 550-bedded hospital, in which we will be getting a special concession from the Prayagraj government, which will be to the tune of 76.52 crores, which will be in installment given to us against the construction.
Okay. Hi, Dr. Sharma. Medal here, also joining in. I want to understand what is the timeline that you're looking at in terms of when this facility will start contributing to your revenues meaningfully, and also on the 45-year concession. Can you help us understand the economics here at when this becomes EBITDA accretive for you?
We feel that it will take about roughly 2 years to construct and develop this 550-bedded hospital, along with the building, the equipments, and the soft furnishing. And we should be able to commission it by January 2029. And if we take the financial year FY30, we feel that we should be able to clock about 75 crores in the first run of the first financial year FY30, and it should be EBITDA accretive. We feel that because there is also an annual concession fee which we have to give to the Prayagraj government, which will be to the tune of 18.10 crore annually, with an escalation cost of 3% annually. So we feel that the EBITDA should be around 6% in the first year. And second year, we feel that we will be able to take it to 125 crore, with EBITDA being somewhere in close to the range of 12 to 14 crores, 14%. And by the third year, we feel that we should be clocking 250 crore with an EBITDA in the range of 18 to 20%.
So that's as far as the EBITDA and revenue potential, Dr. Sharma, of this particular project is. But any other expansion plans that are currently underway at this point in time?
Yeah, in this calendar year, in fact, the identified projects, we will all be putting up about 1,500 bed, out of which 1,040 have already been commissioned in Agra, Panchkula, and Rudrapur. And we will be coming out with 4 more, which will be in Palam Vihar. We are extending 100 bed to the existing facility, Platinum launch, which we are creating next to the 225-bedded hospital which we have. Besides this, in Zirakpur, Meher, we have initiated and we'll be commissioning this very soon, 150-bedded hospital. And in Delhi, Febris, also by this financial year, we will be commissioning 200 beds. So total 450 are pending, which also will be commissioned. So in this calendar year, in fact, we'll have a 46% rise by commissioning 1,490 beds to the current strength of 3,610. So it will turn out to be 4,740.
Okay.
And by the next year,
right.
FY28, we intend adding 1,000 beds more, which will take our strength to 5,740. And in January 2029, we will be commissioning the Prayagraj facility, also 550 bed. so which will take our strength to approximately 6,300 beds.
Okay, that's quite an aggressive bed expansion plan you've highlighted for us there, Dr. Sharma. Can you also walk us through the target debt levels? I mean, you've got quite a lot of expansions underway and even in the horizon. I want to understand what sort of, if you will be taking on any more debt to fund this, how this will be funded, and what's your target debt levels for the FY27 as well as going up to 29?
Okay, so the current expansion, which I mentioned to you, which will take our strength to 6,300 beds. Firstly, I would like to mention that this entire expansion, the capex will be around 35, 36 lakhs, which is the lowest in the industry. One. The second is this, that this entire expansion, we are planning to do it through internal accrual. Thirdly, our term debt, long-term debt is practically negligible, around 25 crores. We have an unencumbered FD and current account together, say around 400 crores. So we are a cash-rich company currently. But if we have any further expansion coming in or any new projects or chain coming in, we are open to debt. We are open to also dilution, because currently the promoters hold 82.9% of the equity, which is a huge number, and we have a margin of dilution there also.
Okay, and one last question. Your balance sheet position continues to remain very strong. You barely have some term debt, and the bank balance also is very strong. Dr. Sharma, what will the utilization strategy be? I do understand that you already have these capital expenditure plans. Will it only be used for this? Is there any other strategy that you're working on with respect to capital allocation?
In the capital allocation, if we come across, it will be only in healthcare, and that will be only if we have some large chain or large institutes or some other hospitals which match our vision and our thought process of providing high quality and relatively affordable healthcare. So that will we'll go for it. In Uttar Pradesh, in fact, if I mention to you, this will be our third project. We have already started Agra, which is 360 bedded hospital. We have commissioned it in February this year. We will be commissioning Gorakhpur 400 bedded facility by the end of this year. And with Prayagraj coming in with 550 bed by January 2029, we will have a significant number of beds, 1,260 beds in Uttar Pradesh. And we feel Uttar Pradesh, with a large population and a very big state, and with a lot of healthcare demand supply gap, we feel that this is a major initiative which we are taking in Uttar Pradesh.
Okay. That was a wonderful conversation, Dr. Sharma. Thank you so much for taking the time out to speak with us. Hoping to have you on board soon with us for another chat.
Thank you so much, Meryl, and thank you, Ashisha.
Thank you.